You don't want to be taking the traditional birth control pill, because the hormones in that, estrogen and progesterone, are going to be in conflict with the hormones you need to continue producing milk. So a doctor is not going to prescribe the traditional pill for you, but you might get prescribed what's called the mini pill, which is progesterone only. Okay, so perhaps you've heard of that. It's called the mini pill. Sometimes it's called POP, progesterone only pill. And the other thing is that you could also have an IUD, right, an intrauterine device that kicks out a little bit of progesterone, and that can actually inhibit you. You won't be ovulating, or you could be ovulating. Well, let me clarify. Progesterone only pill. Actually, let me take it back a couple of steps, because I said something about if you're getting your period, that means you're ovulating. And that's actually a little bit of a misnomer, because if you're on the pill, right, the traditional pill, you are still getting your period, but you are not ovulating. Sometimes when I talk to women about birth control and about menstruation in general, I'm really interested in the fact that a lot of people have a disconnect about what goes on in their bodies. So let's just, make it completely clear here. When you are not on the pill, right, you have your two ovaries, and they generally take turns kicking out an egg. Okay, the eggs become ripened, one gets released, hopefully. If it's two, then you get pregnant, you have twins, obviously. But hopefully one gets released. They take turns, as I said. They move down the fallopian tube into the uterus. The uterine lining has been building up in anticipation for implantation. If the egg is met with sperm and it implants into the uterine lining, you grow a baby. And if not, you shed the lining with the egg, and that is your period. Okay, so very simple, happens every month. Also keep in mind that we are born with hundreds of thousands of eggs. We're born with them. They're already stored in our ovaries. This is why, just to clarify that you're not like producing eggs like every month, they're already there. This is why we have concerns about fertility as women get older, because their eggs get older and they're not as likely to react the way we want them to, in terms of cell division, in terms of implantation, in terms of chromosomal disorders, or things that can go wrong. This is why your chances for having like a problem like Down syndrome or something go up exponentially with age, okay? Because those eggs are aging as you age. That said, that sort of marker of age 35 and over is really somewhat arbitrary in terms of what's called advanced maternal age. So, don't get all hepped up about that. Lots of women have babies after the age of 35 very successfully. Doesn't mean like your eggs automatically are what's the word I want to say, that they're expired, right? They don't expire so quickly. So anyway, when you're taking the pill, right, the traditional pill as we know it, estrogen and progesterone, your lining is still building up, but it's suppressing your ovulation. You are not ovulating. That's why you don't get pregnant. There's no egg to fertilize. Okay, so there's no egg coming out, the lining builds up, you stop taking the pill for those 5 days, or you take a placebo, and then the lining sheds and you get your period. There are all different variations of this. Obviously, there's like inoculations that you can get, and there's the patch. Remember, there are all different ways of administering that hormone to you, and in some of those treatments, you actually don't even get a period. But for all intents and purposes, that's basically what happens. So when you take a progesterone-only pill, which is safe to take while you are nursing, coming back to the question that I'm veering off of wildly, it prevents you from getting pregnant not by suppressing ovulation, but by making your body sort of an inhospitable place for a pregnancy to occur. What I mean by that is it sort of changes the chemistry at the cervix. so that sperm can't get through it so readily. It also alters the uterine lining so that a fertilized egg, if an egg does become fertilized, can implant as easily. Okay, so it's a slightly different method. Also with some progesterone-only pills, ovulation can be suppressed. It depends. You have to find out from your doctor. So do talk to your practitioner about a safe bet for birth control once you've had a baby, because getting pregnant while you have a small baby on your hands is not exactly fun. And again, birth control is just really one less thing that you want to have to worry about. So I also just want to say about IUDs. I mean, IUDs kind of got a bad rap a while ago, associated with certain infections and problems and so forth. But they've really greatly improved them over time. And I think an IUD that kicks out a little bit of the progesterone synthetic hormone is just, that sounds like a great plan, because you just don't have to think about it at all, and it will prevent you from becoming pregnant. And you can still nurse. Another thing I want to say about a pill like that is a lot of people have side effects and complications from taking the traditional pill, or they're prone to blood clots, or they smoke, or they have some other thing going on that prevents them from taking the regular pill. If you take the progesterone-only one, you eliminate those side effects or risks. The risks are associated with the estrogen side. So that's also good to know in case you don't know that already. You have a little bit more flexibility with the progesterone-only pill. All right, so let me see how I'm doing for time. Okay, well, I only have a couple minutes left, so I can't go into another question. So I just thought I'd give my verbal disclaimer. I used to have a disclaimer at the end of my show, and I just stopped running it, that I, the host, am not a healthcare practitioner, a healthcare practitioner or a therapist. If you have any questions concerning the topics I've addressed here, you should seek the advice of your healthcare provider. And also come visit me on my new website, mamarama.tv. If you become a member, you can kind of get into other areas of the site. I want people to be members because I have other things in store, and eventually I'll need like a captive audience for that. And also, on my website I have my blogs, and I really like to write about my experiences as a parent and different concerns that we have in a way that's a little bit different than doing my show. So those could be worth checking out. And lastly, so my URL is mamarama.tv. Someone has mamarama.com. I don't know who they are, but they won't let it up. Every year or 2 years that it comes up for renewal, I can't grab it, and they want a lot of money for it. So maybe someday I'll be able to grab it. But I grabbed .tv because I started my show on television. The funny thing is that the .tv has nothing whatsoever to do with television. It actually stands for Tuvalu, I think. Tuvalu. It is the 4th smallest country in the world. So, you know how, because like URLs in England have a .uk, or in Ireland have a .ir. I don't know. They might have E something because it goes back to Gaelic. I don't know. Anyway, so .tv is in connection to Tuvalu. So check that out, mamarama.tv. And please do send me questions. I love to answer questions, and they could be about anything. Pregnancy, childbirth, and parenting issues in general. Not like I'm an expert or anything, but I like to do my research and spout advice.